Hi there.
Hi, Brian.
Hi, I'm calling from the pharmacy, and my name is Brian, and I'm the pharmacist here. And I hear that you'll be taking over my patients for the next few weeks.
Yep. Where are you going?
I'm going to Hawaii.
Okay, good for you.
Yeah, to get some sun while it's so
right.
cold. So I will be gone for the next few weeks, and a patient recently came in and decided to fill a prescription.
All right.
Her name was Sophie Samuelson.
All right.
She is a 21-year-old female. Her date of birth is 07/07/1992.
She's a patient of ours.
Yes, she's a patient of ours. So she came in a few weeks ago with a prescription for Accutane, and she was a little bit concerned about the side effects.
Okay.
So I used a shared decision-making model that we have here at our pharmacy to just kind of go over the pros and cons of it and with the side effects. And then she took it home and reviewed it, and she has decided to fill the prescription.
Okay.
So I would like you to, if possible, or I would like you to follow up with her after she started taking the prescription, because she will be coming in to pick it up this weekend.
All right.
All right. So regarding her background history, she is not looking to get pregnant in the next little while.
How does she know that?
She told me when we were discussing that, because she's getting married in the next 6 months.
Yeah.
So she said I asked her, and it's like, are you willing to get pregnant, or are you looking to get pregnant? She said no. And then I also conveyed to her that during use of Accutane, she must use 2 forms of birth control.
Good.
So she is on Dian 35.
Yeah.
They also conveyed her the importance of using another method, such as condoms.
Yep.
So if you could, when she comes in, just kind of go over that with her.
I will. Thank you. Yeah.
Other things she was concerned of with side effects, particularly, was dry skin, dry lips.
Yeah.
And so when she comes in, can you go over just kind of those are the side effects you kind of want to monitor, and also ways to help mitigate those symptoms.
Sure.
So I suggested using lip chap more frequently,
Yeah.
and face moisturizers.
Okay. I'll follow up.
Go on with that. What else we got? And the other, so that's kind of just that information when she comes to the pharmacy. Now for follow-up, because this is her first time using it, I'd like you just to phone her after a week, just to kind of look at a little bit of symptoms here and there, for like the dry skin and that, for the dry skin, because the prescription is for 30 days. So I'd like to follow you up.
You only wrote it for 30 days?
Yeah, it's only for 30 days.
So she will be coming back in a month to get the refills anyway.
Yeah.
Okay. That'll be a good monitor. All right.
So just after the first week, kind of just make sure nothing extreme is happening. Like I did talk to her about the extreme side effects, such as pseudotumor cerebri, and skin damage to toxic epidermal necrolysis. Kind of extreme ones to monitor for, but if that happens, I told her about emergency.
Yeah.
And so if you
You
could
felt comfortable with her interaction. She understood what you were going through. She can be compliant.
Yeah, so she was very sure that she would be compliant, especially with like the birth control, being able to do the blood test every 4 to 6 weeks,
Okay.
and all of those other things as well. And also with the side effects, she agreed that the pros of the treatment outweigh the cons. Yeah, and so if you could follow up in 1 week, and then after that with the next refill, when she comes in 30 days, could you also follow up as well? And that, could you also just kind of make sure that she got her blood test done and for her liver test and that, because it should be every 4 to 6 weeks that it should be done.
Okay.
So that could be done as well.
All right.
What other questions do you have for me?
Does she need a base blood test done? Or is it just after the first month?
She should have one done for
Base.
a base, so we
Base
just something to
also.
compare
Okay.
to.
All right.
So if you could just make sure that's done as well.
That's birth control blood tests. No, I think that's all I'm concerned about.
Okay. Perfect. So
When's she getting married?
in 6 months. So the treatment should.
She might be all cleared up. in
She
time
should
for
be
when-
clear, because it's about 4 months is typical treatment.
Okay.
Like, so that should be fine with that.
Do you think 1 week is that soon enough for any side effects to kick in? Or is that too soon to phone her? Just asking. I don't know. I can't remember.
Well, with the dry skin can occur fairly quickly.
Okay.
So maybe refer to her that if she is experiencing any side effects to call immediately if they're discomforting to her.
Super.
Okay. So besides that, sounds good.
Yep. No problem.
Thank you.